Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine here in Bloomingdale, Illinois. Today I wanted to talk a little bit about how important the core really is and how it can affect your body in a variety of ways when something goes wrong. So first I just want to kind of use a diagram just to explain what the core is. So the core, we like to think of it as a box, okay? So as a top, two sides, and a bottom. Up here you have your chest cavity. Down here, well, you've got your legs. And of course here, dividing the chest and the abdomen is the diaphragm. And that's actually the biggest muscle here in the core. So diaphragm. Here on the bottom of your core is actually the pelvic floor. I know, we don't think about this area very often, but it's literally the floor of our core. And of course here on this side we have our different abdominal muscles, back muscles. Those are always what we kind of think of at the sides of our core. Now, if you, let's say, have a real weakness of your diaphragm, we know that the ceiling or the roof of your core, it's not going to be really strong. Usually we'll see with this problems up high. So let's say neck pain, maybe breathing disorders, hiatal hernia, things of that nature. If your diaphragm is not working well, sometimes your abdominal muscles don't work out so well either. And in fact, you can kind of get a split down the center. We call this a diastasis recti. Diastasis recti. This is really common in pregnant individuals, as well as men who maybe have a little extra abdominal weight. Their diaphragm doesn't work very well, the core is not controlling that pressure very well, so it puts too much pressure here in the abdominals, and those abdominals split. Once those abdominals split, as you can imagine, they don't give you very good support and can cause a lot of problems down the road. For other people, they may have more difficulty controlling their back and abdominal muscles together, and they may have low back pain. So there's too much pressure on the lumbar spine, the part of the spine that supports the low back. Or even pregnancy, and this can happen with men too, especially if you have a job where you sit quite a bit or you're a cyclist, you can have pelvic floor dysfunction. So you may have symptoms like pelvic pain or stress incontinence when you leak a little urine, when you cough, sneeze, laugh, or you may even have things like urge incontinence or difficulty going to the bathroom. All these different disorders are technically basically disorders that happen when your core is not functioning properly. So 9 times out of 10, when you come to my office, you're going to end up hearing me talk about the core. That's because it's really the core of our body and really controls everything we do and how we move. So if you have any questions about the core or wonder if maybe you have a core problem and that's what's causing your pain, feel free to check out my website or contact me. My website is www.ducatchiropractic.com. Thanks.